I think if there are a couple of positives to the pandemic we're in, one is the wonderful community support and the ability to come together in such great numbers like we can with Zoom. And we're also becoming Zoom experts, and we'll all be able to add Zoom expert to our resume. And some of you might know that you can create a virtual screen background. And I've seen the San Francisco Bridge too many times and Bali beach settings. But you can also create a background that makes sense. And for me, that's it, because it's Legacy Month at the Barwon Health Foundation. So let's get underway. On behalf of the Barwon Health Foundation, my name is Francis Trainor, and we thank you all for joining us today. Please let me start with the acknowledgement of country. We, the Barwon Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to the elders, both past and present. We thank the traditional owners for the custodianship of the land and celebrate the continuing culture of the Wadawurrung people, acknowledging the memory of honourable ancestors. We also welcome all Aboriginal and Torres Strait Islander people joining us for this webinar this afternoon. Today is obviously being run as a webinar, so you can see myself, Chair of the Barwon Health Foundation Bequests Committee, Jack Ayerbe, who I'll introduce soon, and two most interesting presenters who we'll get on to in a moment. So we can't see you, but you'll also be able to participate, and we encourage that by clicking on the raise hand button towards the bottom of your Zoom screen. So whilst we're going through this preamble, please have a look for that. And then when the time comes, we'll try and unmute you and get your question for our guest speakers following their presentations. Alternatively, you can type a question into by clicking in the chat box. As I said, this afternoon, we've got two wonderful guests I'm very much looking forward to hearing from. Last Saturday was Dying to Know Day, where everyone, young and old, are encouraged to think about having plans in place for end of life, which include advanced care plans, burial and funeral plans, and essentially about having a death literacy, so we can make informed decisions about our dying, end of life care and death, which all makes a lot of sense. Planning also involves getting your affairs in order in a legal sense, and there's a staggering statistic that 50% of Australians are dying without a will, which creates all manner of complications. August is also Legacy Month, a time to celebrate life, pay tribute to our amazing healthcare heroes, reflect on our own lives, consider our legacy, and hear from some extraordinary minds. Now, in support of Legacy Month, several prominent Geelong law firms, including Michelle Tucker, who joins us today, have offered their services free for anyone who wants their will written or altered and wishes to include a gift for the Barwon Health Foundation. So please call or email me if you're interested in learning more of this offer. Now, right now, almost everyone is consumed with this hideous virus and the possibility of falling ill. So it's great to flip things somewhat today and talk about how to stay healthy as we age. So we'll be hearing from Professor Julie Pasco, who also joins us on this topic a little later. Now, I'm not big into social media consumption, but there was a great post by Barwon Health yesterday that some of you may have seen that showed a montage of photos of various Barwon Health personnel, including the Barwon Health CEO, Francis Diver, and many of our amazing frontline healthcare heroes, all wearing the obligatory face masks. And this social media post pointed out that we've just marked 200 days since the first COVID case was detected in Australia. And we all know how life has changed in that time. Tragically, somewhere around 750,000 deaths worldwide, and locally deaths here too, and many people being admitted to hospital. We are now used to daily update press conferences from the Premier, mandatory wearing of face masks, social distancing, restrictions on so many businesses, particularly in the hospitality and the retail sectors, causing so much hurt. No footy in Victoria, who would have thought of that? 8 PM nightly curfews in Melbourne, an economy in peril, and so many other impacts, both large and small. If we'd been told this last year, that this would be a reality, it could hardly have been believed, just a weird nightmare. But we are all incredibly resilient. Somehow we are coping with all the social changes and recreational restrictions to our lives. We do rely, though, on our health service to keep us safe and be ready for us, ready to care for us in our community when we need them most. The post from Barwon Health went on to say that the Barwon Health have created pandemic plans in this last 200 days, built new service models, upskilled new and existing staff, and adapted and responded to the needs of our community, and it performed 54,000 COVID-19 tests, an extraordinary amount of work for which we can all be very, very grateful. The community and Barwon Health Foundation have also been hard at work. Over the past 200 days, we provided life-saving medical equipment, vital sign monitors, an ICU defibrillator, blood filtration systems, emergency department treatment chair, transport ventilator, aged care beds, 50 new hospital beds. Coronavirus research and local drug trial initiatives are underway, and more than 3,500 staff have received a small token of community gratitude in the form of a hot cup of coffee. Most importantly, COVID-19 patients, plus everyone else in our community who needs that to access our health service for a myriad of reasons, are getting the care that they need. Last week, for those of you who were able to join us at the webinar series, we talked about some of the stories of bequests that the Foundation has received and the incredible impact they've had. In fact, just about every corner of the hospital, there's a reminder and evidence of community support. From refurbishments to vital equipment to the smiles on faces of healthcare workers who've just received a meal or a coffee as a token of appreciation. But none of this community giving is new. In fact, Geelong Hospital was built on a legacy of giving from its early days in the 1840s, when a committee was formed by the Reverend Andrew Love to fundraise for a hospital for the Geelong community. They worked hard raising money and then received a bequest, our first bequest, which Jack Ayerbe will tell you about shortly. But the gifts of the Foundation received as legacies are not just about bequests. There's also in memoriam gifts, honouring the life of a loved one, living legacy, and name funds established to grow and provide a sustainable support to Barwon Health. And it doesn't matter how large or small, all gifts will make a difference and have the power to save lives. If you'd like to have more information on how you can make an impact, either now or in the future, please give us a call at the Foundation. We'd be happy to have a confidential discussion with you. Now, please let me introduce a proud member of the Geelong community who has that wonderfully strong social conscience and belief to give back to the region that he loves. He's a well-known, respected and loved community member who's involved in the diverse areas beyond his occupation as a vet. His passions include animal welfare and the fascinating science and research into One Health, which recognises that the health of people is connected to the health of animals and the environment. And we've got time, we might ask Jack a few questions about One Health and COVID-19 towards the end of the webinar. For many, many years, the Foundation was privileged to have Jack's contribution as a member of the Foundation Council, and today he lends a hand as chair and ambassador for the Bequests and Tim Malloy Society. Now, Jack's been in hospital over the past week having hip surgery. In fact, he just got home today, but such is the quality of the man, he didn't want to let us down. He's also a man who has a very, very close appreciation of the health service for care provided to multiple generations of his family. Please give a big virtual hand for Jack Ayerbe.
Thank you, Francis. You know, it also, at my age, is like an oxymoron, healthy ageing, because we have this idea that there's no such thing. So I'll be interested to hear what our speakers say. Now, about 160 years ago, this chap who was a shepherd named Tim Malloy got bitten by a snake, a black snake. I don't know how we know it was a black snake, but it's said to be a black snake, and he died. But as he lay dying, he called for a bit of paper and wrote out his will, and it was witnessed by his boss, who was a well-known settler. And he left, as he's dying, he left his income of 12 shillings a week and 12 shillings 6 a week, his home in Britannia Street, Geelong West. Imagine what that'll be worth now, and all his possessions. This was the first bequest to the hospital, to build a hospital. So this is what started the actual building of a hospital. A few months later, Governor Latrobe visited Geelong and granted the first site. And events moved very quickly, and led by the Geelong Advertiser, eventually we had this Geelong hospital we have today. And it was funded by the community, not by the government, by the community. And it would never have happened without the likes of Tim Malloy. So in today's world, governments more and more are going to be less able to contribute towards funding like health, like other things. Yes, they do a good job. I'm not in any way denigrating governments, but we need to help from our pockets in order to keep the standard of health in Geelong as high as it is, and indeed improve it. If you have children or grandchildren or relatives, it's absolutely vital that we do think of them in our will. Sadly, bequests aren't big in the Australian culture, but let's try and take a lead and see if we can actually make Barwon Health a leading benefit of bequests. Mind you, I should apologise for my voice. For some reasons it's husky. So anyway, we've set up this Tim Malloy Society. What does that mean? We believe if you are going to leave something in your will to the hospital or indeed to Barwon Health in any way, shape or form, you are eligible to join our society, the Tim Malloy Society. We give you a little badge, but we also from time to time, we invite you to functions and bring you to updates and even have a few beers together when we can. So it's becoming a very tight-knit group, and we include everyone in it who has left anything in their will. It doesn't matter how small it is. Every little bit counts. Can I emphasise that? Every little bit counts. So do what you can and join the Tim Malloy Society, and Francis can always lead you towards that. So we can have an impact into helping people save lives. I've always said, and I'll say it again, I say it just as my own experience, if you're going to get crook in Geelong. Let's maintain that standard, that high standard. Now, Michelle Tucker is a lawyer, a Geelong lawyer, even better, the sole practitioner. And now she's practicing predominantly in the area of wills and estates. She also is a lecturer in the law school at Deakin. I must say I'm always frightened of lecturers, Michelle. In fact, I still am. And she's been teaching law at Deakin for over 8 years. She's a committee member at Villamanta Disability Rights Legal Service and is also a member of the Geelong Law Association, the Law Institute of Victoria and the Geelong Chamber of Commerce. So let's have a little right from the horse's mouth, a little bit of a talk from Michelle. So again, a virtual welcome to Michelle Tucker. Thank you.
Thank you, Jack. Thank you, Francis. So I'm here to talk a little bit about estate planning and why it is important. And it is important because you then get to decide how you'll be looked after during your lifetime in the event you can no longer make decisions for yourself due to incapacity. Estate planning also includes considering your wishes that will be carried out after your death, such as who will benefit from your estate. So there's two parts to this. There's your decisions to be made while you're still living, and of course, after your death. Now, there are 3 documents I do ask a client to consider when, looking at estate planning. The first is a medical decision treatment maker form. The second is an enduring power of attorney, and the third is the will document. Now, to make all of these documents, a person must have capacity. And what that means is the person must have capacity to understand what the documents are and the consequences of the documents. That is, the nature and effect of the documents. And a person can lose capacity through illness or injury or disability. And what that means is they may not be able to make decisions for themselves regarding medical treatment or financial or legal decisions. So it's important to make sure a person has capacity also when making a will at the time the will is made, because otherwise it may be disputed by beneficiaries or family members after the death of the will maker. So the first document, the medical treatment decision maker form, appoints a person that you have chosen as your decision maker, the person you wish to make decisions regarding your medical treatment and care in the event you can't make those decisions yourself, maybe due to incapacity. Now, if you don't have a medical treatment decision maker appointed formally, the law sets out who your decision maker will be depending on your family relationships. So if you have a spouse, then they will automatically be your decision maker under the law. Or if you do not have a spouse, it will automatically be your oldest child. And I find some clients prefer to appoint a decision maker formally of their own choice, someone they trust and know that will make decisions in their best interest and in accordance with their wishes. The second document, an enduring power of attorney, is a document where you appoint an attorney on your behalf to make financial or legal decisions for you in the event you no longer have the capacity to do so. So enduring means that it endures even if you are to become incapacitated. Now, the appointed attorney has the power under this document to do anything you legally can. That is why it is important when appointing an attorney that you choose someone that you trust totally, someone that will protect your assets and act in your best interest. For example, my mother is my grandmother's attorney, and my grandmother now lives in aged care, and mum looks after all her bills and her accounts using the power of attorney document. Now, you can choose more than one attorney, and I often find clients may choose 2 joint attorneys if this is practical, you know, if they live in the same region and so forth. So this means that those 2 people appointed have to sign everything jointly together. And this creates a checks and balances system in such, you know, to make sure they are both acting on the same page and in the best interest of the person they are acting for. But once again, the document should only be made if you have full trust and faith in the attorney you're appointing to handle your matters. And I can talk a lot more about that, but that's just the basics for you there. Now, when appointing a medical treatment decision maker or making an enduring financial power of attorney, while you still have decision-making capacity, this is important because then you get to decide how you'll be looked after in the event you do become incapacitated. If you do not have these documents formalised, then it can be a lot harder for your loved ones if you were to become incapacitated. So, for example, they would have to apply to the Victorian Civil and Administrative Tribunal for guardianship or administration to be able to act on your behalf, and this can be a lengthy and difficult process. Now, the third and final document in estate planning is the will. And it can be quite confronting for some clients to make a will. They may not like to think about death or what will happen to their estate or their loved ones after their death. And often they don't really know where to start, what they have to consider when making a will. And lawyers can assist with this and let the client know the things they need to think about. Legal advice is important in the context of a will because there's specific requirements under the law as to what constitutes a valid will. For instance, it must be in writing, it must be signed by the will maker, and it must be witnessed by 2 independent adult witnesses. And most importantly, of course, the will maker must have capacity. Now, your will can set out what your wishes are, such as who you wish to give any gifts to or leave your estate to, the beneficiaries. And this may be your spouse or your children or other family members or even friends. And often a will maker may leave part of or all of their estate to particular causes or charitable organisations. And you can include your wishes regarding guardianship of children that are under 18, or wishes regarding burial or cremation, or organ donation even. Now, they don't have to be included in your will, but they are just some of the considerations that you can put in your will. Now, legal advice is important also regarding the content of your will because there are some assets such as jointly held property or superannuation that are subject to different laws and may not necessarily be dealt with under the will. So that's why it's important to get legal advice regarding the structure of your will. If you haven't made a will, it is harder for your loved ones to deal with your estate after your death. If someone dies without a will, this is known as intestacy, and an application needs to be made for grants of letters of administration through the Supreme Court, which will normally appoint your next of kin as the administrator of your estate. It then takes time to identify and collect the assets of the deceased, and then it is the law that decides, under the Administration and Probate Act, who gets your estate under the rules of intestacy. So for instance, if you have a partner but you don't have children, well then your partner will receive the whole estate. And you know, that could be quite straightforward. But if you have children, and these days, as we know, a lot of families are blended and there's second marriages and children from previous marriages and so forth. If you have children, then under the rules of intestacy, your partner gets the first approximately 470,000 plus half of any remaining balance. And the children get the other half over and above the 470,000 threshold. So it's important you put your wishes in regards to your beneficiaries. If you do not have a partner or children, then it will be your parents if they survive you. Or if your parents do not survive you, then it can be your siblings. And often it will take time to track down potential beneficiaries when someone dies intestate. That is why it's important to have a valid will to make sure your wishes are carried out as to who will benefit from your estate, rather than let the law decide who will get your assets upon your death. And finally, I've noticed during this pandemic that I've had a lot more queries from clients regarding their estate planning, particularly in relation to making a will. And it's important that even during this time, you take your time to consider your needs and your wishes when appointing a medical treatment decision maker or appointing an attorney to make legal or financial decisions for yourself, or appointing an executor for your will. Seek legal advice. Make sure you discuss this as well with your loved ones or those who you wish to appoint, to let them know what your wishes are in the event you were to become incapacitated and therefore unable to make these decisions for yourself. Thanks.
That was great. Thanks so much, Michelle. And we'll just see if there are any questions that anyone would like to ask Michelle. And while we're waiting to see if anyone wants to put up their hand, I mentioned just at the start of the webinar that Michelle was involved as facilitating a bequest to Barwon Health Foundation from a very humble Scottish gent, Archie, who was a concreter, and he left a wonderful gift to Andrew Love Cancer Centre. And it was great to see that not only the gift that he's left us, which is going to care for so many people, but the other beneficiaries were just so proud. They were so happy that this money had gone to a cause. Do you see that often, or is there sometimes arguments?
You do see disputes. Yeah. Money can bring out the worst in people, but this family, as you say, particularly, they had a family member who they lost to cancer, and they were just overjoyed and overwhelmed that Archie, made that decision to give the money to the Andrew Love Cancer Centre in honour of their family member, which is terrific.
Now, I've got a question here. How long does it take to complete a will?
Yep, Zoe. So generally what would happen is I will talk to you on the phone, and often I meet with you. Generally it would be face-to-face to get your instructions and to let you understand what is needed for the will. And then I would go away and draft up the document and then send it to you for your consideration, your approval. And if you have any questions or we need to change anything, I then make those changes. And then there's normally a second time we meet up to execute and finalise the document with the witness. Now, as you can imagine at this time, it is a little bit difficult with the stage 3 restrictions, but I am still having that initial appointment generally with clients via Zoom, and that is working in some cases. But of course, I can still meet with clients, with social distancing in place and so forth. So that's not an issue.
So we've got a couple of other questions. Marion has asked, my mother had another document that she thinks was called a power of guardianship on advice of a solicitor, which dealt with those matters not covered by medical or power of attorney, such as where she would live if unable to live at home, who could visit, how long they could visit, arrange social and lifestyle support, and something or other. Does this still exist?
I'm not sure myself, Marion. I'd need to look that up. The thing is, even with the changes to the law, like the medical treatment decision maker form, anything that was made prior to these changes, which came into effect in 2018, are still valid. So it used to be, for instance, called a medical power of attorney. So if you made it back in 2015, that is still valid. You don't have to make a new one. So it could be valid. I don't know specifically that document, but I can have a look at that.
There's another question here. I'm not sure if I understand, but what recognition do families get when they leave a gift in a will?
Are you talking maybe about a gift to like the Barwon Health Foundation or a charity? Is that?
I'm not 100% sure on that one. I'm not sure. I know I saw some details online that there was in the 64 plus category, the number of people who had purchased an online will recently had gone up something like 8-fold, which is extraordinary, and I guess a sign of the times, and somewhat not unexpected given that age group would be thinking probably more about their mortality and their end of life. But it also showed that in the 18 to 24 age group, that the numbers had gone up 7-fold, the number of people who'd just purchased a will. Have you seen that sort of?
Oh, for sure,
yeah.
sure. The inquiries are escalating. I personally aren't, you know, a fan of store-bought wills, wills from the post office and so on, homemade wills, because I think, you know, there's too many things that could go wrong, and all those extra steps to confirm the will is valid, you know, in case it's not. So that's why I do think legal advice is important, and especially in relation to those things such as superannuation and joint property holdings, which may not actually be covered under the will. And it's hard sometimes for clients to understand that.
Now we've got that question clarified. Yes, it is. If I leave a gift to Barwon Health, how's it recognised? Well, the answer to that one is a little bit difficult. It depends on the size of the gift. Some of you may know that the Andrew Love Cancer Centre received a gift, a very substantial gift from Beth Allerton. The Allerton family were well known in Geelong. They manufactured shoes, and her gift has been recognised with the naming of the oncology pharmacy. So that's now called the Allerton Family Oncology Pharmacy. It could be something like that. It could be a leaf on our legacy tree. It could be a plaque on a door. It could be a plaque on a bed. There's so many different ways that your gift can be recognised. But if you'd like to get in touch with us, we'd love to have that discussion and let you know. We also like to recognise people whilst they're still living too. We see a lot of bequests come through and we haven't had the chance to thank the person for making that gift. So part of the reason for the Malloy Society, which Jack was talking about earlier, is to connect with those people and to, you know, show them recognition and appreciation while they're still living. So I think that's probably about it. And I want to thank Michelle so much for you know, giving us time today, and also giving us time in offering a free will service for our Legacy Month to those who want to leave a gift to Barwon Health Foundation. It's very good of you, Michelle. And if anyone wants to take advantage of that, please give us a call.
No, thank you. Apologies for that phone that comes through the computer.
That's fine. Thanks so much, Michelle. And we'll hand back to Jack.
Thank you, Francis. Can I say, Michelle, what a lovely presentation, and you must be one of the few lawyers that don't use legalese as your language, because I understood every word that you said. Absolutely fantastic. Thank you. Now, introducing Julie Pasco. Julie is a Professor of Epidemiology at Deakin University, situated at Barwon Health. She's the Director of the Epicentre for Healthy Ageing. There's that word again, healthy ageing. Deputy Director of the Impact Strategic Research Centre and Impact Institute Theme Leader, Population and Epidemiological Analysis. Professor Pasco is an epidemiologist with a background in biochemistry and physiology. Her population-based research focuses on understanding the progression of chronic metabolic and musculoskeletal disorders and the nexus between physical and mental health. And I think that is one of the critical issues today, and how poignant as we sit with this coronavirus. She leads several population-based studies, including the long-running Geelong Osteoporosis Society, the Vitamin D in Pregnancy Study, and Ageing Chronic Disease and Injury Study. An important component of her research is to facilitate the knowledge transfer from research into practice within the community. And that in itself is a marvellous asset. We welcome Professor Julie, who is going to enlighten us on healthy ageing, healthy bones, and healthy mind. Welcome, Professor Pasco.
Thank you, Jack. So I think I'll start off by addressing your question about healthy ageing before I start. So by saying healthy ageing, I don't mean longevity. We're not after trying to extend people's lifespans, but what we are after is for people to remain healthy as long as possible during those older years, and try and keep people autonomous and out of institutions. So my talk today is, first of all, I'd say thank you to Francis for the invitation. It gives me great pleasure in being able to talk to you about the Geelong Osteoporosis Study. And I thank Francis for the invitation to participate in this Barwon Health Foundation Legacy Month webinar series. So my talk today is Healthy Bones, Healthy Minds and Healthy Ageing. And I'm just going to add to that and add healthy muscles to the list because today I'm going to introduce a new term to you, which is sarcopenia. But let's start off with the bone statistics. So 4.7 million Australians aged 50 years and older have osteoporosis or osteopenia, which is like pre-osteoporosis. And for those with poor bone health, osteoporosis accounts for 22% of those, and osteopenia 78%. And about 162,000 fragility fractures occur each year in Australia. And at Barwon Health, there's approximately 300 hip fracture presentations every year. And osteoporosis is not just a women's disease. Men account for about a third of fragility fractures, so it affects men as well as women. And the burden, the cost associated with osteoporosis in Australia is about $3.8 billion a year. Now, I'd like to draw your attention to the pictures at the bottom, and you can see normal bone on the right, on the left, and there's a picture of osteoporotic bone on the right. And you can see that compared to the normal bone, the bone structure, and this is trabecular bone or the honeycomb type bone at the ends of the long bones, you can see that the struts have worn away. And so you can imagine how loss of those bone connectors really reduces the bone integrity and makes the bone so much more fragile and likely to fracture. So now I'd like to have a look at muscle, once again, looking at someone with healthy muscle, a young healthy muscle on the left, and an older sarcopenic muscle on the right. So this is a cross section of the upper leg, the thigh, and the area in the middle there is the bone, and this grey area around here is the muscle. So you can see in this young healthy thigh muscle, there's quite a lot of muscle, and there's a very thin layer of subcutaneous fat around the outside. Now, by contrast, when you have a look at the diagram on the right, you can see that the muscle is smaller, cross-sectional area has reduced, and the subcutaneous fat is quite thick. And you can see that the fat has infiltrated into the muscle. So it's in between and around the muscle fibers. And once you get that fat infiltration into the muscle, it greatly reduces muscle performance. So you lose muscle strength and you lose the ability to have quick gait speed and function physically well. So this is data that we've actually generated in the Geelong osteoporosis study, and this shows the relative changes in the mass of muscle and bone as people age. So we've got age across the horizontal axis and data for the men on the left and data for women on the right. And it shows how muscle and bone mass decrease together as people age. So for men, the reduction starts just short of age 70. But for women, the reduction starts earlier, and that's really related to the changes that occur earlier associated with menopause. Now, these are average values for our participants, and you can see that if someone loses more bone than is shown here, they'll end up with osteoporosis. And if someone loses more muscle than is shown here, they'll end up with sarcopenia. So sarcopenia, by definition, is loss of muscle mass, loss of muscle function, which will include poor muscle strength and poor physical performance. So the muscle and bone tissues are living tissues. They have a rich blood supply and a nervous supply. They're adaptable and they're changing all the time. And we know that muscles and bones are connected, physically they're connected, so that when you do exercise and the muscle contracts, it moves the bone because they're connected. But there are other things that connect the two tissues. And we've got chemical messengers that are released from the muscle and from the bone. Now, if they come from the muscle, these little cytokines, these little proteins are called myokines. If they come from the bone, those little cytokines are called osteokines. And if they come from the fat, which could be the fatty layer that's surrounding the muscle, or it could be from the fat within the bone marrow area. They're called adipokines. And these messengers have effects on each other. The muscle cytokines have effect on the bone cytokines have effect on the muscle. So they interact that way. But they also influence general metabolism in the body, and they can also influence brain function. So I'll tell you a little bit about the Geelong osteoporosis study, where we're studying these things. So the Geelong osteoporosis study has been running since 1993. It's a population-based study, which means we've involved people from the community. We haven't selected people on the basis of disease. We've selected them from the electoral rolls. And they ranged in age from 20 right up to the 90s to participate. And we have all sorts of people: fat, thin, healthy, unhealthy, with osteoporosis, without. It's a big mixture. And because of that study design, we're able to look at not only osteoporosis, but all sorts of diseases. Now, the study is situated in Barwon Statistical Division, shown in yellow here, which is a fantastic area for epidemiological research. It's like a living laboratory, because it has distinct geographical boundaries, a known population, well-characterised population. It has a mixture of rural and urban communities, a range of socioeconomic and multicultural groups, and people are quite happy to be involved in such a health study. I find that people happily come along to Barwon Health to have their assessments done because they feel as if it's their hospital and they're keen to help. So the GOS is made up of 3 parts. The cohort study, we've been following people over time. Case control studies, where we've recruited groups of people with a certain condition and then compared them to healthy controls from the cohort study. And we're also monitoring all the incident fractures that occur in the region, making a register, and that's called the fracture grid. So what sort of information do we collect? Well, a lot of clinical measures. So to identify changes that occur in the musculoskeletal system, we scan the participants and we use DEXA, it's a bone scan. We also use some equipment known as a PQCT, which I'll show you a photo of in a moment. And we're also trialling a new instrument known as the osteoprobe, which uses a technique known as impact microindentation. You can see a bit of a photo of it down there, which is a brand new design, and you measure what's known as the bone material properties by using this instrument to indent the bone on the tibial plane, on the leg, on the lower leg. It just requires a local anaesthetic. It's a bit like going to the dentist. And that instrument, it appears as the skin rests on the bone, and then it administers a force, and we measure how far it makes this micro indentation into the bone. So we're participating in this worldwide new piece of equipment, and we're the only ones in Australia to be using it. The other measures include ultrasound. We measure the heel ultrasound to look at bone structure in the heel. We measure height and weight, blood pressure. We do physical function tests of balance, hand grip strength. We also do lower leg strength and gait speed or walking speed. We test vision, and we have cognitive tests. We use computer-based test of cognition, and also use the mini mental test. We collect blood samples periodically, and now we're collecting stool samples and mouth swabs because we're doing work with microbiota. Our participants are very patient, and they answer so many questionnaires, and these document their exposure to drugs and diseases, family history, falls and fractures, their lifestyle, so we get information on their diet, alcohol use, their smoking practices, their sun exposure. We document their reproductive history, and we determine their quality of life and well-being, their pain they experience, health literacy, which is becoming quite important in the new patient-based or patient-centred decisions on health management. And all the participants undergo a detailed clinical interview to identify depression and anxiety, and we can also diagnose personality disorders. And here are some photos of some of those tests underway. So this is the Hill ultrasound in the top left. And here is a stadiometer being used to measure height. Now, this obviously isn't a participant of the long osteoporosis study. This is a participant of the vitamin D in pregnancy study, which involves children. On the left here, we have blood pressure being measured. This is a photo of the DEXA in action. And this is the PQCT that I mentioned before. This is a more recent acquisition, and that gives us detailed information about bone structure and muscle structure. And we measure, we do images in the leg and the arm. And the picture on the top right there isn't someone playing patience. It's someone who's participating in the CogState test. That's the computer-based test for cognition. And you don't need sophisticated computer skills to do that. You just press buttons as things change on the screen, and it tests cognition in several domains. So back to sarcopenia. So as I said, the sarcopenia measurement usually involves a measurement of muscle mass using the DEXA, for example, a measurement of hand grip strength using a dynamometer. And we do the timed up and go test, which is called the TUG test, timed up and go. And so these require a little bit of time and equipment. And a screening questionnaire is being developed to see who might go on to need these more detailed tests. And I just want to spend a moment having a look at the questionnaire so you could see how you might score on such a screening questionnaire. So for all these attributes here, we've got a scale list going from none to some to a lot, which is scored 0, 1 and 2. So I thought if you respond in your mind about what your response might be and keep a tally in your mind, we'll see whether you might be at risk of sarcopenia. So first of all, how much difficulty do you have in lifting and carrying 4.5 kilograms? So score yourself against that scale. How much difficulty do you have walking across the room? Once again, none, some, a lot. How much difficulty do you have transferring from a chair or a bed? Once again, 0 to 2. How much difficulty do you have climbing a flight of 10 stairs? 0 to 2. And how many times have you fallen in the past year? None, 1 to 3, or 4 or more falls. So tally up your score, and if you've got a score of 4 or more, then you might indeed have sarcopenia, and it would be worth seeing your doctor and seeing if you could be referred on to have further testing to see if indeed you might have sarcopenia. So a little about the interrelationship between mental health and musculoskeletal health. And I'm using that term musculoskeletal now because, as previously described, the muscles and the skeleton are interconnected. So there's a bi-directional link between mental health and musculoskeletal health. So people with mental health conditions are at risk of experiencing chronic physical conditions. And on the other hand, people with chronic physical conditions are at risk of developing poor mental health. And potential causative factors could include chronic inflammation and oxidative stress, endocrine imbalances, that's hormone imbalances. And some of these come about merely because of the aging process, but also because of other factors. So for example, if you're carrying too much body fat, so if you're obese, that'll increase your levels of chronic inflammation and oxidative stress. And that causes inflammatory cytokines in your blood, which affect the muscles and the bones, other systems in the body, and also it affects the brain. And I'll show you some examples of some research that we've done in that space. And endocrine imbalances include, the consideration of how the level of hormones declines as you age. Now, the lifestyle factors that impact on this relationship are physical inactivity. So if you lead a sedentary lifestyle, you're feeding these problems. Smoking and high alcohol consumption, and poor nutrition. And I should add there, poor body composition as well. And just a word on the brain muscle loop, as it's called. Deteriorations of the brain muscle connections, they involve motor neurons, they're the nerves coming from the brain, and neuromuscular junctions. That's where the nerves meet the muscle and trigger the information from the brain to the muscle to make it work. Those junctions all deteriorate with age. And so that can lead to, linking cognitive function with muscle loss because of this interrupted passageway between the messages from the brain to the muscle. This results in physical inactivity, which can increase falls risk and cause mobility disability. And the dopamine signalling in the brain, the pleasure signalling in the brain decreases. It lessens the reward signals, and it diminishes motivation to be physically active. And so the whole cycle continues on a downward spiral. Now, here are some, it's just some examples of a way that we've found that indeed systemic inflammation, that's inflammation in the body, circulating in the body, can be a marker for the onset of disease, in this case of incident fracture, and also the development of new major depressive disorder. So what we did was we took our data from our baseline visit for our participants and measured the CRP level in their blood. It's a marker of inflammation. And the x-axis, the horizontal axis here, is the time since that blood sample was taken. And the vertical axis here is the probability of remaining free of disease, in this case, free of fracture. And the graphs here represent the CRP, the marker of inflammation, going from red through to mauve in increasing amounts. And here you can see that as the CRP levels in the blood increase, there's a shorter time until you sustain a fracture. That just means that those with highest values of CRP, the most inflammation, are at greatest risk of sustaining a fragility fracture. We're the first in the world to report this, and as a result, it ended up in a publication in JAMA, and others have since gone on to confirm that finding. Now, similarly, we set up an analysis in a very similar way. This time, however, the axis on the vertical axis is the time till the development, the first onset, sign of onset of major depressive disorder. And once again, the CRP values, a marker of inflammation, goes from low through to high. And you can see that the ones with the highest CRP were at greatest risk for developing major depressive disorder. And this went on to fuel a whole lot of randomised controlled trials that are being done in the IMPACT SRC, where medications known to reduce inflammation are being trialled to see whether indeed they reduce the onset and the management of depression. So here are some sets of results, if you like, that we've got from our Geelong osteoporosis study, linking mental health with musculoskeletal health. So these are just examples. So we found that depression was associated with increased risk of falls and also increased risk of fracture. People with depression over 1.5 times more likely to fracture compared to those without. And we found that depression was associated with lower hand grip strength and poorer physical performance, as we measured by measuring their tug, their timed up and go. We found that anxiety increases the falls risk in men quite substantially, a 3-fold increase in falls risk. But we didn't find that pattern in women, something that we're going on to see why that is. And an exciting area of research is the relationship between cognition and musculoskeletal health. So we've recently looked at low muscle strength in the legs and found that that's associated with poor cognition, and that was poor overall cognition as measured by the mini mental test. And we found that muscle strength and walking speed, rather than muscle mass per se, indicated poor cognitive function. And we also found that muscle density, remember I was talking about the infiltration of fat into the muscles, and that makes the density lower. that's associated with poor cognition as well. And the domains of cognition that were affected were psychomotor function, which involves precise motor responses, attention and problem-solving abilities, and also visual learning domain. And visual learning involves having to see something, to visualize something, to be able to interpret it. And so this is starting a whole area of research for us, a very important area of research, because if any link can be found between musculoskeletal health and cognitive health, it offers new opportunities for interventions, for prevention, because especially the muscle health is open to modification through changes in lifestyle. And so that's why this area of research is so important. Now, to avoid falls and avoid fractures, there's several lifestyle things that you can, patterns that you can follow. So good nutrition is very important. It's important to avoid malnutrition, both for muscle health and for bone health and for overall health. So the recommendations are 1,500 kilocalories a day for women and a bit more for men, 1,700 kilocalories a day for men. And within that diet, you should make sure that you've got adequate protein, and that would be in the range of 1.2 to 1.5 grams of protein per kilogram body weight per day. And these protein parcels are eaten at 3 times of the day, equally distributed between breakfast, lunch and dinner. So you're spreading out your protein intake over the day. And of course, calcium intake is important, and so is vitamin D level. The recommended calcium intakes for people aged 50 to 70 are 1,100 milligrams per day, and you need more if you're over 70, so over 1,200 milligrams per day. And it's best if that can come from your diet rather than supplements. Interestingly, we've had a look at the intakes of protein and calcium for people in the Geelong osteoporosis study. We found that the protein intake actually was quite good. So 88% of our participants met the protein requirement, but only a quarter met the RDI for calcium. Now, most of your calcium comes from dairy products. You can get it from other sources as well, leafy green vegetables and oily fish and things like that, but it's definitely lower than it should be. And the other thing to pay attention to is the vitamin D nutrition, and it's particularly important for muscles and bones, but also for mental health as well. Now, most of the vitamin D comes from casual exposure to sunshine, because you manufacture vitamin D under the skin after you've been exposed to UV radiation. But obviously you have to balance the exposure to sunshine with cancer risk and skin damage risk. So you've got to be very careful not to overdo it. However, the time spent in the sun is actually quite short. You only need short bursts of sunshine on your skin to develop enough vitamin D. So only a few minutes during a day at summer. Obviously you need longer at winter, but you would avoid in summertime, of course, the middle of the day where the UV exposure radiation is very high. All right, so good diet, good nutrition needs to be coupled with good physical activity patterns. So how do we protect ourselves? Now, these are the recommendations for physical activity that should be undertaken by older people. Now, obviously, this is going to depend very much on your individual health status. And so it's important before you embark on any training regimens that you have advice from either a physiotherapist, a doctor, or an exercise physiologist. And if you've got, for example, fractures in the spine, you've got to be very heavy in how much weight you lift and the way you lift it. So it's very important to be guided in these physical activity regimens. So strength training is very important for the musculoskeletal system. So it's also known as resistance or high impact training, and that's recommended for at least 2 days per week. Now, to get a response from exercise in the bone, you really have to put stresses on the bone. So you've got to do these types of exercises to actually get changes appearing in the bone. A way you can do this is to use body weight against gravity, or you can use weights, lifting weights, or you can use exercise bands, such as the ones shown in the photo here. This was a seminar that we gave a few years ago where we demonstrated the use of resistance bands. And resistance bands get, according to they're colour-coded to tell you how strong they are. And you slowly start off with the ones that are least resistant, and over time you change to more and more resistance. So you increase the amount of pull on your muscles and on your bones as you progressively increase the strength training exercises. Now, the strength training should also be accompanied by aerobic physical activity. This is particularly important for a healthy cardiovascular system. And it should also be coupled with balance exercises. So the aerobic physical activity should be done about 150 minutes per week, and the balance exercises every day. And these are simple things that you can do at home very easily. As well as doing dancing and exercise programs like Tai Chi, you can also walk on your toes and on your heels. This is good for challenging your balance, and it will slowly improve the more and more you do it. You can just do simple things like shifting weight from heels to toes while standing, but be supported by something, a wall or a chair. You can try walking heel to toe along an imaginary line. And that sort of training really does help. You can do it while you're cleaning your teeth or watching television or preparing a meal. And there's simple things that you can do at home. So just before I close, I'll reiterate that our purpose is to not prolong the lifespan, but to try and improve people's health so that as they're aging, they have a better health in older age. And that includes a healthy musculoskeletal system and a healthy mind, and that paves the way for healthy aging. And of course, I don't do all of this alone. I've got a great team of researchers, and in the absence of a group photo, I thought I'd have a Zoom type gallery. And I'd just like to acknowledge some people here. So on your left there is Dr. Cara Holloway-Q, and she heads up the musculoskeletal pillar of our GOS. Associate Professor Lana Williams, who heads up the mental health pillar of GOS. We have Dr. Hyde, Natalie Hyde, who looks at health across the lifespan, and she has a particular interest in looking at early life exposures, which may influence diseases that manifest themselves in later life, like sarcopenia and osteoporosis. Some of these diseases are now being traced back to the environment experienced in the womb, so even before birth. Dr. Sarah Hosking on the right, she heads up the pillar of social determinants of health in GOS, and she has a particular interest in health literacy. And the others shown there are either involved in data management or indeed undertaking PhD projects and are heavily involved in data collection. Thank you.
It's wonderful. Thanks so much, Julie. We've got a little bit of time for questions. It's just on 3 o'clock, but we'll see if any questions come through. I'd actually would like to ask when we were putting this together, I was looking for a little photo of you. And I mentioned earlier, I found a lovely photo of Julie playing the cello. And I read that she'd only just recently, in the last few years, had taken up that instrument, that musical instrument. So I'm just wondering, I know that the diet's very important, physical is very important, but challenging your mind, how important is that to healthy aging?
Oh, definitely. So it's the same with whether it's physical health or mental health. Just to keep challenging the system. If you don't put stresses on the system and put up these challenges, if you don't use it, you lose it. That old saying. So it's very important. And this is something that's actually arisen during the COVID-19 pandemic. Concerns about how well people are keeping up their efforts to, to do all those things that I've just mentioned, but also to manage their chronic conditions, because people are quite nervous about venturing out of home, going to doctors, what have you. But please, I implore you to keep your appointments. Make sure that you manage any chronic conditions that you have. There's quite a lot of telehealth being conducted at the moment to make sure that you keep on top of those conditions. And also, don't drop your hobbies. I know that our social isolation has meant that we're not interacting with people face to face as much as we are used to. But if you can maintain interests and contact through electronic media and keep challenging your muscles and your bones and your brains, then that will all help people get through the COVID-19 crisis. And I should add too that we're about to survey all our GOS participants to see how they're faring during the COVID pandemic, with a particular emphasis on mental health. And how that's changing in response to isolation and the other restrictions that have been imposed on us, and also making sure that people are managing their chronic diseases.
There is a question there. Do you think that the pandemic will have a devastating impact on mental health of the old population?
Yes, I think so. And social isolation is one of those really important factors. So, connectedness is very important. And when people are not connected with others, definitely their mental health suffers. And if you think of that muscle-brain loop, that it would set off that spiral, that downward spiral. So it is a testing time.
And Julie, what about the funding? How are you funded?
Yes, well, funding's a never-ending problem. We rely on funding from competitive grants, through bodies like the NH&MRC and the MRFF. Very hard to get those. Competitive is definitely the operative word there, but we do keep applying for those. It takes an enormous amount of time and energy to put in those applications, and we have some success. We also have some philanthropic funding through bodies that foundations that provide philanthropy, and we have some support from industry where possible. So the study is enormously expensive to run, as you can imagine. So the measurements of our participants are one-on-one, so they're really in-depth and time-consuming. And a lot of our PhD students who are involved in those projects are on scholarships, either from Deakin or from societies, or supported by philanthropic donations. Our early career scientists, the ones in that top layer in the gallery that I just showed you, they are the ones where funding is absolutely crucial, because they're tomorrow's researchers, they're our tomorrow's leaders, and it's very good strategic building to support them. And it's very hard to find funding to support them. So fellowships, they've had some success with fellowships, once again, from competitive sources and from university and from government and from societies. But we would certainly welcome any money to help salary support for those early career scientists. As for the costs of analysing blood samples, that's an ongoing cost, and consumables too, when those are analysed in the lab. And the other consumables that are costly are the tips associated with that new piece of equipment that I said we were testing, the impact micro-indentation system. Those tips on that piece of equipment we get from America, they're still handmade at the moment, so they're very expensive, and they're one-off use.
Yeah. So if anyone does want to support Julie's work, just let me know, and I'll be more than happy to put you in touch and get some more information, and hopefully we can help Julie with her important work. There's another question here, Julie. How often should a body scan be done after the age of 70?
Yes, well, no more often. Don't do it any more than once a year. because things change fairly slowly, especially bone. So once a year is adequate. Once every 2 years for someone who's not at risk of osteoporosis and fracture would be adequate. But you'll be guided by your GP there or your endocrinologist, because it does depend on the individual and whether they are at risk of severe bone loss, and severe risk of fracture. And of course, there's management strategies that can be put in place there. They often monitor a response to therapy to see if the pharmacological intervention is working.
And Kaz has asked, does muscle strengthening exercise reverse levels of, is it sarcopenia?
Yes, yes, that's right. So the work that's been done to date has found that strengthening, if you can increase your muscle strength, which does respond quite well to the type of exercises that I just described, it does actually, you can reverse sarcopenia. So, and it's not too late. At any age, you can try and keep up a healthy lifestyle that includes those exercises. And you start off at a low base, but you build on it. That's the secret to trying to develop muscle strength and conquer sarcopenia.
Look, we've now got to 3:07, so we'll probably have to wrap it up there, but we've got so many messages of appreciation. Thanks for both you, Julie, and to you, Michelle. So thank you so much for that. We've got another webinar next week with 3 prominent clinicians from the Andrew Love Cancer Centre, which will be fascinating. So please log on for that one. You can register for that now. And in our 4th week, we've got a webinar with Professor Peter Villeman, who's going to talk about research and the amazing clinical trials that are happening right here in Geelong. Are you involved in clinical trials at all, Julie?
No, our research is purely observational. Yeah. So we don't have any interventions at all. But what we do is document any changes people have in their medication use or their lifestyle or an event, like a fall or a fracture or an onset of disease. And so we can see how that changes their trajectory as they age.
Terrific. And I'll just hand over to Jack to pass on thanks.
That was quite extraordinary. The only, even asking, saying thank you beforehand, obviously, as someone who swims every day for about an hour and a half, with our swimming, Julie, that really covers the whole lot in what you're requiring.
Well, it does, but it doesn't give you the impact exercise that's important for your bones. So you probably need to supplement that with some high impact exercises.
Walking and playing football. Julie, thank you very much. Never ceases to amaze me the amount of good work that's being done which no one knows about. And your presentation today, not only again, as last weekend with Michelle, I understood every word of it. So apart from JAMA, that's a different thing.
That's the Journal of the American Medical Association, extremely prestigious scientific journal.
Congratulations. No, well done. We do appreciate it. And this is going to become more and more important. If we can take the advice that you've got and get that out there, then the last 10, 15, 20 years of people's lives are going to be so much more enjoyable. So on behalf of the Foundation, on behalf of the Bequests Society and my colleagues, the wonderful Bob Eadie and Mike Fairweather, thank you very, very much. And we really appreciate what you've said. We're going to take it on board, I can tell you. We start running next week. Thank you.
Thanks all.